Hello, and welcome back to Sharing a Chapter a Day. This is Do, Ra, me, and today I will be reading Chapter 52 of Engagement in Peril by Dara, Odoe, Sup. Chapter 52 is titled Reporting for Duty. First Command, Naval Medical Center, San Diego. Hematology, Oncology, Corpsman. About several weeks later, after spending some time with my family and friends back in Long Beach after graduating from Field Medical Service School, and missing my good friend Shinshin, in my dress white, I arrived to and checked in at the Naval Medical Center, San Diego. Once I checked myself at the quarterdeck, personnel and records, and payroll, I was then assigned to the Hematology Oncology Clinic, where we treated patients with cancer and/or blood diseases and disorders. I loved working there at that always busy clinic. I loved working with the staff and personnel there, who were experts at their fields, duties, and responsibilities. It was one of the best learning experiences one can have then. That place has taught you much, Dara, and you still remember from stuff from way back when. You were the man there and in that clinic, man. You were the shit. Wish we could turn back the hands of time and put you back to where you belong. Well, it was wishful thinking on my part. The fine personnel that devoted their time and effort at the Hematology Oncology Clinic were as follow. Captain M. Browning, who was head of the Hematology Oncology Clinic at the time, he's one of the good guy. When we first met, he had thought that I was a Navy diver of some sort during our introduction because of my large plastic diving watch. Dr. Browning taught me the importance of customer service when dealing with patients and people in general. He was a good leader for our clinic, and he knew his way about the various diseases and illnesses that the clinic managed. About a year later, Dr. Browning decided to retire from his naval career and focus on his family life with his very young wife and their cute little children. The mini, the man pretty has it made. There was also Captain C.S. Hunter. She was the Director of Medical Services, DMS, at Naval Medical Center. She was a cute, petite woman in her early 40s then, with a young daughter. She later became commanding officer of Naval Medical Center in San Diego and attained the rank of Rear Admiral. She was encouraging to all the staff, and I admire her for her hard work and dedication. At times, I remember thinking and seeing Dr. Hunter as a sex tease for my young, freakish mind then. I would have loved to get up and put it inside her then. Also, there was another good doctor there at Hematology Oncology Clinic, Lieutenant Commander P. Gable. He taught me a lot about patient care and contact. I would assist him whenever he needed me to, and he sometimes allowed me to do some of the procedures that he performed on patients. He had a nice family, a good devoted wife, and several young children as well. He was one of the younger and newer doctors in our clinic. There was also Commander Hager. He taught me how to perform paracentesis and allowed me to do it by myself on several occasions when patients agreed to his suggestions and recommendation of my knowledge and skills of the task at hand. He even invited me to his Thanksgiving dinner with his family one year, when we feasted upon a scrumptious turkey meal and enjoyed champagne, and afterward we walked along the breezy beach of Coronado in San Diego. Now there's also Captain F. Millard, who took over the position of our clinic commanding officer after Dr. Browning retired. I assisted Dr. Millard whenever he needed me to. He was pretty cool, strict and straightforward, but cool all the same. Dr. Millard was there when I had my minor angina episode that late June. He led the treatment of my early death smoothly and got the ball rolling in getting me the help I needed then. He's a good naval officer and devoted to his family and work as well. A retiree and now civilian and most skilled doctor there at the Hematology Oncology Clinic was Dr. Lukin. He was terrific. He was once a naval captain as well and once ran the hematology oncology clinic and internal medicine as well. He knew a bunch about blood diseases and cancer diseases. He taught me much there, always willing to help and teach me, and quite the fantastic motivator as well. He also took an interest in my angina case. He had a lovely young wife. She could have been his daughter. She was that young. They both had a very cute boy, a cute baby boy. Dr. Lukin was one of the many people I looked up to and admired during my experience and stint there at the hematology oncology clinic. There was also Lieutenant C. Kuzma, who was the youngest of all the doctors there in our clinic. He was pretty new to the clinic, and he was pretty cool though. I assisted him in several procedures throughout my time there. He once gave Huerta and me ticket to the Chargers preseason game, and it was on the 50-yard line where we saw the cheerleader up front and personal. Of course, their fake boobs were right in our faces as well then. I helped Dr. Kuzma perform a bone marrow biopsy on one occasion. The patient was a young 18-year-old female who was the daughter of an active duty personnel. She was a bit chunky and was scared of the procedure that was about to be done on her. Her mom accompanied her while in the operating room. The bone marrow sample extraction was a simple procedure. We needed to get some marrow sample from her hip bone. The procedure was a clean procedure, which was quite quick. But we had a snag doing this one with this particular patient. First off, we began with having her lie down on her stomach and expose her lower back midsection. We then prepped the area. First, we numb up her lower back locally with some lidocaine, and then we numb up her hip bone real good, and then we made an incision into her lower back area where we would want to get the marrow out of. Then we would use a corkscrew driver-like instrument to hand drill her hip bone to get to the marrow. Now, while screwing down the turning object, it would catch and rip out some marrow from the inside of her bone, and we would use that marrow as our biopsy specimen. Dara, you were quite handy with that medical tool and instrument. You knew your way around the human body and was one of the best corpsmen on that command. I reminded myself of what was once great. The problem that we had with this procedure on this day was that the girl was in a lot of pain through the whole process and ordeal. Since she was much chunkier than most patients we usually do bone marrows on and extraction on, the lidocaine didn't do quite as well for her, and we had to numb her up several more times to get the pain to lessen on her. Dr. Kuzma was having a problem getting the marrow out of her as well. He first tried the left side of her hip bone, and the procedure took him a long time. He was sweating and getting tired, and the girl was crying the whole time even though her mom was comforting her during the whole procedure. Her cries and anguish got Dr. Kuzma sweating more. He didn't want the mom to think that he didn't know what he was doing. He felt sort of embarrassed then as well while he turned red in the face. Still, he continued with the procedure and kept his focus on the task at hand. Several times he looked in my direction with some reassurance from me. Dr. Kuzma was practically on top of her back with all of his weight trying to extract some marrow from her. She was in agonizing pain during that ordeal. Once the left side was done, we took about 10 minutes to catch our breath, took a rest, and recover, also allowing the girl to catch her breath and ease the tension and worry that her mom may have had then. After the short rest, we move on with the clean procedure to her right side. But this time the young doctor asked me to perform the simple procedure. I was happy to do the simple procedure and prepared myself for accordingly. I first numb up her skin area along her lower back right side, and then I proceed to numb up her hip bone area, making sure to get to her what I was doing while I was making sure to let her know what I was doing while I was went about poking at her side and hips. After I made a small deep incision through her low back skin, and then I proceeded with the hand screw. For some miraculous reason then, I don't know if it was just me or just simply luck, she was in less pain and wasn't moaning as much as previously. And I seemed to get to the marrow quite quickly than Dr. Kuzma had. And we finished the whole procedure shortly after. Dr. Kuzma chuckled and giggled and shook his head side to side at my quick result, and the young lady and her mother was glad that the procedure was over and done with. Afterward, we bandaged up her wounds and told her to relax and not to do too much strenuous work and to wait a day or two before showering. We allowed the young lady to get dressed alone with her mom in the room with her, and after she had finished and ready for transport, we then escorted her in a wheelchair while her relieved mother paced alongside us back to the hematology and oncology clinic several hundred yards away in the connecting building. And then with the specimen we had extracted from her, we took it to pathology to run several tests to find a match for the bone marrow transplant operation later on when there was a donor who matches her blood type and makeup. See, Dara, how great you were once? Why can't you get back to that day of old when you were young and vital? Not like the you are now, sickly and weak. Damn, that Catholic bitch sure did a number on you several years back. A person that encouraged me to get my hand deep in, participate, and learn a lot in the hematology and oncology clinic was Commander M. Kane, a wonderful, strict medical professional. I helped her in most of her procedure, almost daily. She allowed me to perform many thoracentesis and other medical procedure, and she trusted me with all of them. She taught me a lot about cancers and blood diseases as well. Dr. Kim and I were like a team, you can say. She was the brain, and I was the surgical machine back then, controlled by her will and professional direction. Dr. Kim wasn't shy to tell you if you did wrong or right. She gave praises when it is deserved, and she gave out disapproval when it was deemed necessary. Dr. Kim eventually made captain and decided to stick with her naval career as a bit longer. She once asked me if I would like to work for her when she opened up her own medical cancer clinic in Durango, Colorado. I look forward to that day when she opens up her own clinic, and I will be glad to work for a person like her. I'm sure she would make a wonderful boss of a private medical clinic and such. She's one of the few doctors who inspired me to better myself in all aspects of life. That's why I put myself through that horrendous program with Boost in Newport, Rhode Island. I remember, Dara. Boost really messed you up. That asshole Marine Major should have been the one to be booted out of the Navy, Armed Force Service, not you. Sad to think that you might have become if you were to stuck through it. Hell, you could have been the Navy CNO if you were allowed to get through the whatever you were doing. You would have been the Joint Chief of Staff with the title of 5-star Admiral for the Department of Defense at the Pentagon. Damn, you had so much aspiration then, Dara. What the fuck happened? Another female doctor there in our refined clinic was Dr. S. Norton. She spoke Spanish fluently. I had assisted her in many of her procedures with patients as well. And we did a couple of spinal tap together on a patient who had spinal cord cancer and AIDS. In this particular procedure, we had to be extra careful by triple gloving and wearing specialized garment and protection with visors and such. And we had to be really careful not to damage the patient's spinal cord during the procedure. First, we had him balled up into an infant position so that his spine was clearly exposed, and so we can count down on his spinal column, and also the fetus position allow opening between the spine so that we may insert and drain fluid from his spine during the procedure with an elongated needle that was about 1.5 feet long. The whole procedure had to be sterile. All equipment and tools then came pre-packed in a sterilized casing. We began with numbing him up locally, then slowly, very slowly, and then meticulously, we pushed the medicated liquid treatment into his spine and back muscle. While injecting the elongated needle into his spine, every few millimeters or so, we would stop and ask him if he was still able to feel and wiggle his toe. If he said yes, we continue on deeper into his spine and continue to give him his treatment. Dr. Norton is quite the cute doctor then. She had a younger sister who was so fine herself. Her sister worked with special education children and adults then, and several times I was able to volunteer my free time to help them with their activities out in the community. After all the doctors there in the clinic were hematologists and oncologists, and all were very experienced and skilled in their fields, and all I came to admire. Those doctors were great people, Dara. Those doctors are really great people, Dara. They sure taught you a lot, and they all seem to have the same goal for you then, to better you in all your knowledge and future endeavor. Several of them even thought you would make a great admiral one day, as I laughed at myself. With all the procedure and surgical ordeal I had performed then while assigned to the hematology and oncology clinic, it was the thought of Shinshin and his never giving up attitude and determination that got me through those life-threatening procedures with flying colors. He was always there as my guiding angel. We also had several wonderful nurses who played intricate roles in treating and assisting patients. There was Lieutenant Commander Kay Ballantyne, a single mother of several young children. She was a nurse practitioner then who was motivated and was hardcore about her duties and tasks. She was also in charge of all the enlisted medical personnel in that clinic, including myself. She was my boss then. She took me under her wings and guided me to be the best hospital corpsman in that particular clinic. And she always kept us up to date about new training and update on procedures and requirements. She taught us about safety and patient care in treatment room. She was also the head nurse in the treatment room. She backed us up whenever I did whatever I did in the clinic. I can say that Commander Ballantyne was the foundation that held the clinic together between enlisted and officers then. The cutest and loveliest nurse that I remember there at that clinic was Lieutenant Caress Allo. That's right, her first name was Caress. So kawaii. She was a cute petite Filipino nurse who had recently transferred from the oncology ward. Back then, I had quite the crush on her while I was working there. And I think she knew it too that because everyone else knew in the clinic that I liked her very much because she had that fine ass. The lieutenant would always be there to help whenever I needed her. She was the one who helped me with putting my boost program packet together and also wrote me several letters of recommendation as well. Lieutenant Ella was such a hot nurse then, with small ample bosom and very fine eyes. She's a good and talented person, and I really appreciate her for being for me at that time, for being there for me. A year or so later, she married Mark, her longtime boyfriend and fiance, who was a computer programmer of sort for some big company. I guess I lucked out this time. I wanted more from Ella besides being her protege. I wanted to be inside of her, all up inside of her. I so wish we could have had an affair then. But it was never meant to be, and I accepted that, and I would cherish the time we did have. Caress Allo reminded me of that lovely receptionist at the St. Mary Hospital emergency room back then during the LA riots of 1992, and she too I have come to admire and hope for the best. Also, she reminded me of Beverly. I wish her a long, happy life with Mark, her husband. Another Filipino nurse who was quite a little bit older than Caress was N. Abuyan. She is one of the two civilian nurses that worked there in our clinic. The other was Sweet A. Tyson. Both older nurses taught and mentored me and the other nurses who were assigned to our clinic. Both nurses took a little liking to me and always looked out for me during my stint there in the Hemout clinic. Both older nurses were really good to all the enlisted personnel. They taught me and mentored us as well. They allowed me to help them with their chemo push and injection at times and help them with setting up the chemotherapy treatment. At times, they would bring out our clinic baked goods and such to share with staff and patients alike. We also had a gifted pharmacist there in the clinic. Natalie and her family was from the country of Lebanon. She was such a wonderful person. So very smart, and she encouraged me to go to college and to never give up on my goals and future endeavors. Besides mixing and blending chemotherapy treatment, Natalie also taught and comforted chemotherapy patients on their treatment, illness, and side effect. She was quite a damn good at what she did then. I remember a time when I was asked to drive to Natalie's family home in La Jolla area to pick up some Lebanese food like hummus and some dipping sauce of sort that her mom had prepared for our clinic's Christmas party. Natalie gave me a good, precise direction to her family home. It was a nice drive and lovely neighborhood. And once at her home, I rang the doorbell and was invited in by her brother. While I waited for her mom to finish packaging the goods to be taken back to the clinic, I was also given some refreshment while I waited. Their home was quite nice, spacious inside and out. They actually had an indoor swimming pool right next to their kitchen area. I was quite amazed of their vast and spacious, expensive home. Years later, Natalie had come up with some new form of chemotherapy treatment for cancer and blood disorder patients, and she made millions on the treatment that she had created. Before I left for Boost, Natalie was engaged to a doctor of sort. I wish her all the luck in the world for her happiness and security. Natalie's the person that gave me the determination plaque that kept me going every time I looked at it. I have kept it with me ever since I left the clinic. I remember a mentor and a friend. There was also Commander Jackson. who was a doctor in endocrinology rheumatology clinic right next to ours, in internal medicine. She used to work for G.H. Bush when he was our 41st president from 1988 to 1982. She was also my personal doctor for my ill condition of high cholesterol and other medical problems. She decided to take my case on and treat me for my illness. Commander Jackson was very, very, very attractive, with large boobs and firm body. She had short, dirty blonde hair and a wonderful smile. She had a young baby then, and oh, so adorable she was. That baby was so very lucky to be able to get to suckle on Commander Jackson's luscious nipples and mammaries. Makes me jealous. A wishful thinking on my part about that matter. There was also Lieutenant Junior Grade Domingo. She was cool and I had to teach her some stuff about the clinic when she was the newbie to a fine running oil machine clinic. Domingo was also Filipino. She was weird of sort. The United States Navy sure had lots of Filipino enlisted and officers. There was the sweet, tyrannical Karen Kruger. I love her like a mother. She was the clinic's medical clerk. She was cool as hell and she wasn't afraid of anybody, and she expressed her feeling loud no matter who the hell you are. Karen was always on my side. She helped me so much. She was my friend, just like a mother, always away from home. Karen was a single woman who had prior military and had gotten a pretty rotten deal out of life then, but loved her job as a medical clerk for our clinic. She was tough and loving. She had no children and loved her dog Rags to death. She treated him better than most people she knew. She took care of me when I needed to be looked after and taken care of. She was firm and direct to anyone. She was a true friend then, giving and big-hearted. Last I heard, she had moved to Texas and worked as a medical clerk at the Veterans Hospital there. I hope one day to run into her again, and perhaps we could shoot the breeze and shit about old times. Karen Kruger was like a mother to me, and I never forget her for that. Her teaching, her lecture, and her berating about fallacies and ignorance. Happy days, Karen, and warm wishes, Mama. Also, there are 3 medical clerks in the clinic whose duty and responsibility were to schedule consult meetings in between new patients and other doctors and specialists. There was Patricia, who was really tall and really cool. She had a daughter who was also really tall. Pat was the clinic CEO's personal secretary as well. And there was Linda, who loved horses and owned a few on her ranch out on the outskirts of town. And there was Brenda, a very sweet woman who always gave me sweets. And we sometimes talk about this and that when I hung out in the back area. All 3 women were like mothers to me as well. They looked after me and always put smiles on my face, no matter the occasional situation. They were really good people. Now, introducing the enlisted personnel here in the Hemont Clinic. My fellow corpsmen were Petty Officer 3rd Class, Alex Huerta, who was from Santa Barbara and had an affluent family up there. Hospital Corpsman Apprentice, Danny Marai, who was from New York, who competed with me in getting our foreskin removed. Hospital Corps Recruit Rachel Hankoop, who had a twin brother and from a large mixed family somewhere in the Midwest. Hospital Apprentice Chris Carlo, who was born and raised in San Diego area and community. And HM3 Chris Cuchero, who was from the Philippines. There was also HM3 Valdez, who was also Filipino and very good at what he did. He ran the clinic for some time and he went to C school for a specialized medical field. There was H.A. Marcelo Martinez, who was from Texas and very comical, who was the one who gave me the name Pocket Hercules. There was H.N. Larry O'Neill, who was from Louisiana and loved alcohol. And there was Hospital Apprentice John Spainhauer, who was from the Midwest and from a very affluent family, who was beaten by his wife for jacking off and getting caught over the 900 sex call number. There was H.A. Dorothy and H.R. Diaz, who were recently straight out of A school and sent to our clinic. None of the enlisted then I had previously mentioned could be compared to how much I had devoted my heart and thoughts to Shinshinigami. They were all good people, and we all got along nicely, but they didn't have the same relation that Shinshin and I had made since our time and stint at basic together. Shinshin was constantly on my thought and heart then. I sure wish he was doing well. I hope that I meet up with him once again someday. You know, when you really want and crave something so bad, it might just happen. And that's what I was hoping for then. To be reunited with Shinshin sometime down the road in our older days. Besides having enlisted corpsmen working there, we also had several volunteers to help us out around the front desk. A Red Cross volunteer named Bill Williams, a good old veteran who was in the Army for about 30 years or so before he retired. And now he spends his time helping us out at the clinic as a volunteer. Booking, canceling appointment, and taking messages for doctor. He was married to a Korean woman whom he loved dearly. There were 3 other senior citizen volunteers who helped us all around on a daily basis. All were wonderful people and good people. God bless them all for their help and hard work. The hematology oncology clinic had its own personal laboratory. There was Jerry, who was really cool. He treated me like his son, and at times people took him the wrong way due to the fact that he was gay. He taught me a lot about counting blood cells and such. Anything to do with blood and its makeup, Jerry knew. I spent some time hanging out with Jerry and even went to his home once for lunch with his mother. Jerry has 2 grown children then. There's also Maureen and Carmel. Maureen was a sweet older lady with one of the reddest hair I've ever seen in my life. She who was helpful and delightful to talk to. There's also Carmel, a petite Filipino woman who had several good-looking daughters. She had such a strong Pinoy accent. All 3 technicians taught me much about how to run blood specimen samples and culture through various machines and counts white cells and blood cells and checking for various enzymes and makeup of the blood. Those were all terrific people then, and may God bless them all as well. Thank you for listening. This is the end of chapter 52. Be on the lookout for chapter 53, titled Living Quarters. This is Do, Ra, Mi, and I'll see you later. Thank you.